Welcome to Breathe California TV. We've been off for the last year. February 14th of 2020 was our last show, so appreciate having you join us. We're going to be talking with Dr. Sulochina Lulla, a lung expert, doctor. I'm going to have her talk a little bit about her credentials here in a bit, and respiratory problems, particularly COPD, which is Chronic Obstructive Pulmonary Disease. Breathe California helps people with about 15 different types of lung disease, and Dr. Lulla is going to focus mostly on COPD today, but a little bit on coronavirus. So come back and join us in 30 seconds. We'll see you then.
What it feels like to have an asthma attack is, well, you can't breathe and you can't tell anybody that you're having an asthma attack because you can hardly talk. You can maybe say one or two words, but you can't say much else. Breathe California has helped me come in contact with more asthmatics and more people who have the same case as I do. It's important to me because I don't feel like I'm alone in the fight against asthma.
Welcome back. This is Breathe California TV. Breathe California is the lung health organization for the state of California. And with me is Dr. Sulochina Lulla, who's been active for the whole time that I have for the last 30 years.
40 years.
40? So tell us a little bit about Breathe California. With a year off, some of our audience may have forgotten what we've been telling them.
Hi. So Breathe California was initially associated with the Lung Association, and that was Lung Association of America, American Lung Association. And then we changed our name to Breathe California. So right now, this particular branch covers a large territory. We are based in the Santa Clara County. We are down up to, in the south, we go up to Santa Cruz and a little further south than that. And we've also incorporated with San Francisco. So this particular branch covers a much bigger area than it used to do before, because our branches in the south and in the north both have integrated with us. About
So
20
Breathe California, the Bay Area seems like a good name for that.
Yes. Yes. So as I said, we used to be called American Lung Association, but we have branched out from them. So our message is, our main goal is to make sure that you guys all have very good lungs so that you get enough oxygen into your body. So any disease, if that interferes with giving you problems, means you don't get enough oxygen. So our main goal is to make sure that you have a healthy pair of lungs. That's our mission. That's the main mission that we are here for. Yes.
So you mentioned, Dr. Lulla, you've been involved for 40 years. What do you do for the Breathe California?
Well, I'm on the board, one of the board members, and I provide whatever medical information they may need for their population. So if there are any particular lung problems from, say, smoking, and recently we had wildfires, environmental hazards, and we also work with pollution. We work with tobacco control. We want to make sure people don't destroy their lungs by smoking. And currently, with the present thing, we are involved with COVID. So we want to make sure that people are taking precautions, that they don't get this infection. And if they do get the infection of COVID, post-COVID, if there are any damage to their lungs, we are there to help them and guide them on the right track.
So tell us a little bit about your background. You're uniquely qualified for working with Breathe California.
I worked for 40 years with Kaiser Permanente. I'm qualified as a lung specialist. I've done my boards in pulmonology, pediatric pulmonology, and I'm an allergist immunologist. And so, as I said, I worked in Kaiser and was helping also with the COPD program there, and whatever needed to be done to keep a person have healthy lungs. That was our main goal, is to make sure that you have healthy lungs, you get enough oxygen in your body. That's why I got involved with Breathe California. We used to do children's camps, which we probably will have to start again. So we start with from infancy to the grave, patients who have any lung problems. We cater to all age groups and all lung problems, lung diseases.
So I just recently started an example of that, which is in December, I got a CPAP machine. What are those initials stand? What kind of problems is a CPAP machine for?
CPAP stands for Continuous Positive Airway Pressure, CPAP. So some people, due to many causes, obesity, for example, is one cause, aging is another cause, muscular weakness. If you're not able to breathe well and you don't get enough oxygen because of lack of breathing, you're not breathing well, there is a machine called Continuous Positive Airway Pressure, or CPAP, that blows in air into your lungs with positive pressure when you're not able to take a deep breath by yourself. So this helps you, and this probably is seen mostly when you sleep. When you sleep, your nervous system may send a message to your lungs, but the lungs don't expand as well when you're half asleep. So the CPAP, that's a positive airway pressure, is a machine that blows in air under pressure into your lungs so that you get enough oxygen. And
exactly. So since mid-December, I've been wearing one every night, 8 hours a night.
Mm-hmm. And I'm sure you've noticed that your sleeping pattern is much better. You feel more rested the next day.
I'm not taking naps as much the next day. Exactly
Right.
what you just said.
Right. So that's the whole purpose of CPAP machine. Yeah.
So our principal focus talking today is on COPD. What does chronic obstructive
pulmonary disease.
What?
So chronic obstructive pulmonary disease, one of the main causes is smoking. So fortunately, the population today is conscious of the damage to your lungs with smoking. So we don't see smoking as, it's still probably a big area of concern. Smoking damage to your lungs causes chronic obstructive pulmonary disease. So that's the leading cause. Then there can be environmental pollution. Just as I mentioned, there was fires, or the type of work you do. If you're working in some production line where there are chemicals that you have to handle, and if you don't have proper, guards in terms of masks for that, like for example, COVID, okay? So we have specialized masks for people working in industry. You can have chronic obstructive pulmonary disease from some childhood damage. If you had some respiratory problems as a child and your lung got damaged, you could have chronic obstructive pulmonary disease. But the main cause is environmental hazards and smoking. Anything toxic to your lungs could lead to COPD, chronic obstructive pulmonary disease.
So it sounds like that's not nearly as much a problem for children as it is for adults.
Some children, if they, particularly premature children, or if they had some pneumonia at a young child, it could give them some lung damage, and they could have a different variant, not what we see in adults, but some lung damage, which could give them the label of COPD. And then they will become oxygen dependent from childhood. So we have, but fortunately that's not as common. But they're seen mainly in premature children or children who had severe pneumonia in their infancy.
So what sort of special programs are there for coping with COPD?
Well, the main thing is exercise. We always want exercise. the part of lungs that you have left, whatever you have to deal with, you want to make sure that you don't get further damage. So exercise is an important part. And of course, oxygen, if oxygen has been advised for you to use oxygen, then you have to make sure that you are, using oxygen at night or whenever whatever they've recommended, because we do what we call sleep studies. And the sleep study, we find out how is your oxygenation in the body at night. And most of the time, if it's low, then you are recommended to take oxygen therapy at night. So that's the main thing. And then the CPAP machines, anything that can help you breathe better. So that's one of the ideas for treatment for these diseases.
So I know I'm asking you to guess, but my wife is in assisted living and her roommate is on oxygen. Is that likely to be from COPD?
It could be COPD, or it could be that she had bad pneumonia or something else in her, whether it happened only as an adult. She had a bad pneumonia. You take mainly in these nursing homes. If a person gets a pneumonia, there could be resultant lung damage. And even though she was not previously oxygen dependent, now due to aging and the damage caused by the infection that she has, her lung reserve, bank balance in her lungs went down, so that she now needs oxygen for survival. So it all depends on what she had while she was in the nursing home. And this is a problem now for any infectious disease. So the nursing homes are a big battleground for these infections that they spread. Yes.
Yeah, my wife's nursing home at the start of the epidemic had 94 residents, and 25 of them died, 24 from COVID and 1 from natural causes.
Yeah.
Pretty scary what they are as a source for contagion.
We have to be very careful with any of these things, any like flu epidemic, anything which is, airborne, tuberculosis, all these things. The nursing homes have to be that's why they are closely monitored and inspected by by agencies to make sure before they get their license renewal, all these conditions have to be met by nursing homes. Of course, COVID, has changed the whole picture because of its high infection rate.
I think we probably already get this idea, but how serious is COPD?
As I said, it is serious, and in the old days, that's about 20 years ago, we did not have this close monitoring that we now do for COPD. So we detect it at a very early stage, and we start the patients on a good program for COPD with regular exercise, oxygen use, good nourishment. So all that adds up. So every day as we move forward, we have newer drugs for people who need medications and monitor their lung damage and monitor their progress with aging or added infections, nutrition, exercise. There are multiple factors to see how the person is handling what they have in their bank balance, which is the bank balance means how much is your bank balance in lung capacity. So that we monitor very closely on these patients. We do what we call lung function tests, called PFT, pulmonary function tests, on a regular basis.
So if I'm watching this show, what sort of symptoms would make me suspicious that I might have a problem with COPD?
Well, first of all, if you had a smoking history, that's number one. Second would be, did you have any pneumonia or any kind of lung issues when you were growing up? Third thing, if you're doing any mild or moderate exercise and you're getting too short of breath compared to your cohort, people your age and this thing. So you have to mention, think about what's wrong with my lungs. If your exercise capacity is going down, your breathing capacity is going down, and at night you're not feeling rested. So all these things you have to find out and see why you're not having the lung power that you should have.
So tell me a little bit about lung capacity as you age. I had an experience at a Breathe California walk that was pretty sad.
So
They
what
gave
we-
me a lung test and told me immediately that I needed to go see a doctor. And
Well,
it turned out the problem, according to the doctor, was they didn't understand how old I was.
Yeah, so they're age-related normals, right? Just that you have
Right.
blood pressure, which is normal at a certain age, which may be abnormal at another age. So similarly, we have lung capacity measurements. And if you fall out of that curve, then you're suspicious as to what's going on in your lungs. So we do what is called PFTs, pulmonary function testing. And there are some simple gadgets like a peak flow meter, which we use in asthma patients. It's like, measuring your blood pressure. So we measure your lung capacity and your capability. So we do these tests called breathing tests. We can do pre-exercise, post-exercise tests. So this has become a really sophisticated business. For certain job requirements, they will definitely want you to have this lung function test done before they can hire you. For example, if you're a police officer or a pilot, those kind of issues where lung capacity is very important. Yeah. So we have ways of measuring your, the amount of COPD that's interfering with your lifestyle by these lung function tests.
I assume spirometry is the name of one of those kind of tests.
That's exactly right. Spirometry is a fancy name for it, which is otherwise called lung function tests, right? PFTs, pulmonary function tests.
So how is COPD different from things like COVID and asthma, which are also lung diseases?
Well, each one produces a different norm of lung damage, right? COPD has some particular form of lung damage. COVID, we are still learning. Every day we're learning something new as to what COVID is causing, what kind of lung damage. It can be not just a reduction in your lung capacity, it could be physical damage to the lung, the lining of the lung, which could get damaged, so you're not getting enough oxygen. So you have to measure where exactly the problem is. The lung function tests are just one of the tests that will help us put the nail on the head to find the diagnosis. But you may need more than that. Of course, you may need x-rays, you may need nighttime monitoring of your oxygen, and in very, very difficult cases, you may need a lung biopsy to see what is the damage that the COVID has caused or what has led to this problem.
So we're going to take a break from talking with Dr. Lulla now and do a 30-second message about Breathe California's programs.
It's given me a chance to get out and be with people who has the same problem. And it helps you to manage your life better too, because you hear different things from each person, and it's just been really helpful in many ways.
We're back now, Dr. Lulla. Why don't you talk about how we treat COPD?
We basically treat COPD if there is an obstructive component. That means there is obstruction to your breathing. We give you what we call a bronchodilator, which dilates your breathing tubes, okay? The lungs are like inverted trees. So the branches, if they're very thin and small, we try to expand them so that you get enough oxygen. So we do these different tests. And depending on where your problem is in the lungs, is it in the tubes? Is it in the alveoli where the oxygen exchange takes place? Is it fibrosis where the lung just cannot expand? So we try to diagnose where exactly your problem is, which is causing you breathing difficulty, and then try to address that issue specifically.
Besides having brochures to help you understand the many different lung ailments, what kind of things can Breathe California do to help somebody impacted with COPD?
Well, I think the first thing is that they can arrange for you to be monitored to see whether you're having low oxygen at night or not. So some oxygen monitoring may be done. Then the breathing test that you talked about, like spirometry, can be done. We can give you a home gadget, like a peak flow meter, where you can monitor your lung power by yourself and bring the record in so we can look at it. And then we can recommend the right studies to go for what we call the sleep study, where your oxygen is monitored during sleep to see what exactly is happening with you. But people who snore, for example, before they get treated, we can, look at those the results of your sleep study and try to help you, and give you a home spirometer, as I said, to monitor you for your normal activities and with exercise.
Yeah, the sleep study for me was pretty astounding. They found that I was waking up 83 times an hour. Pretty mind-boggling.
That's
with
scary.
The
right.
CPAP machine, it's about once an hour.
Yeah.
So the improvement and energy levels have just improved monumentally.
So that's why oxygen is called this thing of life, the breath of life. And that's why we are called Breathe California. That's why you come to us, to help you breathe better. We help you diagnose where the problem is. Yes.
So under your and my name, we've listed the Breathe California website, which we urge people to check out, which is lungsrus.org. Or if you have questions, give them a call at 998-5865 in the 408 area code. Anything that I forgot to ask you about here?
Well, if they have any problems related to shortness of breath, breathe, exercise tolerance, snoring, and if they're worried about air pollution with all these wildfires and other things that are happening, and if they have been in contact with COVID patients or they've had COVID, then we should probably, monitor your lungs to make sure that you don't have lung damage as a result from that. So they can approach us for anything that is, they suspect that lungs are the cause. That's why we are called Lungs Are Us. Our website says Lungs Are Us. So you can contact us for any of these issues. Obesity is another thing to worry about. When you're obese, then you don't get enough oxygen because your diaphragm is pushed up and missing. So a very obese person should also get regular lung functions done to make sure that they are getting enough oxygen at night.
So when do you decide your problem's bad enough you ought to go to a doctor?
When you compare yourself with people who your age, the norms. And if you feel, hey, I have a friend who can walk faster than me and I can't keep up, I get short of breath, or I'm not getting enough sleep at night, my family members tell me I'm snoring and waking up and coughing. So all these are issues that, if you've noticed a change which is not the norm, and you can always, even if you're just worried and anxious, if you're an anxious person, you just want to make sure, hey, do I have normal lungs or not? Contact us. We'll do your breathing tests and, help guide you as to whether you are having numbers which are too low or not adequate for you.
So you may be embarrassed about it, but pay attention to your significant other. My girlfriend complained about my snoring, which is why I did the sleep test, and she was absolutely right.
Yes.
It really was worthwhile to go in terms of my energy level to do things.
It's good that you had a girlfriend who cares for you.
As opposed to one that doesn't?
Yes. You may have a girlfriend who's more worried about herself, and
yes,
has a
absolutely.
hidden agenda.
So we've got about 2 minutes left. I'm just trying to think of some things that I should have
Is there
asked
anything
you.
is there anything in the chat box? Do people have any questions?
I don't think anybody gets to hear us yet. In other words, this is being recorded and edited, and then it will go out.
Oh, so people are not listening in yet. Okay, I thought
No.
this was a live program. Okay.
Yeah.
It's not a live program. Okay. All right. Well, do you have any other questions you want to ask about lungs? And
Well, one of the things you emphasized was the problems created by smoking. Breathe California has smoking cessation programs to help people
yes,
stop.
yes, right. We have stopped smoking seminars, and groups meet so that they try to help each other to learn from somebody else. That's important. And I would encourage regular exercise is a good thing for your lungs. So, and then if you do have sleep apnea, to get that evaluated in case you need to have oxygen at night. So when you see that there is dramatic change in your breathing, when you were feeling good before and then suddenly there's a dramatic fall in change, then you need to probably, get yourself evaluated. Yes.
Exactly. So is there a Breathe California group for people that keep getting stuck in wildfires?
And there's no group as such, I think, that unless it's in that northern part. But I had to give a talk for when they had the last fires and people as to what they could do in terms of the atmosphere when outside was impossible. They had to stay indoors. So there were certain changes we had recommended for indoor environment when there are wildfires and smoke outside. So this was
Exactly.
the program.
Well, I have us running out of time now. As always, Dr. Lulla, you've been sensational. Hope our audience has learned a lot from your expertise as a lung doctor.
Thank you. Thank you. And if they have any questions later on, they can always call us at Breathe California. We're willing to answer them.
408-998-5865.
Thank you.
Thanks again, and stay tuned for another show in about a week.
To learn more about what COPD is, what can cause it, COPD screening and prevention, signs and symptoms, diagnosis and treatment, and living with COPD, you can visit our partners at the National Institute of Health's Learn More, Breathe Better network. You'll find great information, resources, and all sorts of educational materials at bit.ly/learnmorebreathebetter. You can also find COPD information on Breathe California's website at www.lungsorus.org/COPD-resources. In our COPD for Seniors presentation, you can find out all the basics about COPD, who is at risk, how healthy lungs work, how COPD affects breathing, and more. In a recording of our 2020 World COPD Day webinar, you'll learn from keynote speaker Dr. Antonello Punterieri, Program Director of the COPD Environment Program at the National Heart, Lung, and Blood Institute's Division of Lung Disease, practice yoga breathing exercises suited for seniors and people with COPD with Ashwini Sapur, the Executive Director of Yoga Bharati, and find out about occupational therapy for COPD patients with Dr. Gigi Smith, Chair of the Occupational Therapy Department at San Jose State University. On our page, you'll also find informational materials that will be helpful for people with COPD in English and other languages, as well as pulmonary rehabilitation resources and medical facilities for the California counties in our service area. Breathe California has worked to reduce the impact of lung disease for well over a century. Our organization began as the Association for the Study and Prevention of Tuberculosis in Santa Clara in 1911, becoming Breathe California in 2006. During the last century, our name has changed, but we have remained the same community-based organization, dedicated to the core mission of fighting lung disease through prevention, education, services, and advocacy. Learn more about us at www.lungsorus.org.